I'm excited to work with Trukera, and that's their new name, and it really reflects a commitment toward being a leader in corneal health. And their newest product, ScoutPro, is a reflection of that. So I'm really happy to be working with them and to really communicate to doctors the importance of identifying hyperosmolarity and how that can help your clinical outcomes. The percentage of patients that are receiving premium IOLs really puts the onus on the doctor for predicting who can be good candidates and who aren't. Dry eye and irregular ocular surface can really affect the outcome and the eventual overall patient satisfaction of your surgical patients. Having an objective test that can identify that preoperatively, and then you can set the expectations with the patient. It gives you the opportunity to treat the dry eye and maybe cure the problem, or they may have such severe dry eyes, you might find in, say, a rheumatoid arthritic patient, that they may not be a candidate for certain kinds of lenses because you can't rehabilitate the ocular surface. But the idea of having an objective test to be able to predict who has these issues is very powerful. When we look at the importance of hyperosmolarity and identifying it, and we look at the basic science, we can see that there's cellular damage on the ocular surface. But we want a more practical use or an idea of why identifying is important. And we look at the surgical results. K readings are critical. And we see that in Alice Emetropoulos' study, she clearly identified that the K readings are not predictable, and measurements of absolute astigmatism were not predictable in the hyperosmolar patients. And up to 1 diopter of difference. So if you look at the graphs in the study, they're really impressive. And you see that you get this feeling that performing this objective test that's going to tell you these corneas are irregular and be able to eliminate those outliers is really a valuable contribution to achieving great results, especially with premium IOL patients. When obtaining the osmolarity data in the practice, the new ScoutPro by Trukera is just so much more efficient. My technicians can actually keep it in their pocket. They perform a test, and 10 seconds later, they have the data. This is a great improvement over the previous technology. My practice is actually a mature practice, as I am, has evolved to the point where a high percentage of patients are receiving premium IOLs. I'm literally over 50%. And to have the ScoutPro, which can efficiently detect hyperosmolarity preoperatively, is crucial because these patients, as we all know, are very demanding. So being able to identify that and then treat the dry eye preoperatively gives you much more confidence in making these very high demanding patients satisfied after surgery.